Welcome to our Take Down Tobacco Day discussion. We're excited to recognize National Take Down Tobacco Day. Take Down Tobacco Day is a nationally recognized day that addresses tobacco and nicotine prevention across our country. It's no mistake that it takes place on April 1st, April Fool's Day, because the tobacco industry has been manipulating and fooling young people for decades and decades to start using and become addicted to nicotine and tobacco products. My name is Shannon Spurlock. I work at JSI out of our Providence, Rhode Island office. JSI is a public health consulting company, and we've been doing work around tobacco control for over 25 years. So we're really excited to have this discussion today. I'm going to hand it over to my colleague, Rachel.
Thank you, Shannon. Hi, everyone. My name is Rachel Morse, also from the JSI Providence, Rhode Island office. We have the pleasure to be with two longtime tobacco prevention advocates with whom we have worked alongside now for many years. Dan Fitzgerald and Jennifer Wall, both from the American Lung Association, and Jennifer representing the Tobacco Rhode Island Coalition. Dan and Jennifer, please tell us about yourself, the work that you do, and how you got started in tobacco education or advocacy work.
Sure. Well, I'll kick us off. First, I just wanted to say thank you, Shannon and Rachel, for having us here today. My name is Dan Fitzgerald. I am a National Senior Manager of Advocacy with the American Lung Association, and I currently lead up our tobacco policy work here in the state of Rhode Island. I was born and raised, and I still currently live in the southern part of Rhode Island. And I first started getting to be a part of the tobacco control movement as a youth advocate in my community. I was probably around the age of 12, and I first started to get involved when I was working to help pass local smoke-free parks and beaches policies in my community and surrounding communities. And since then, it's looked a lot of different ways at a lot of different organizations. I've worked for state and federal agencies and local, state, and national nonprofits, where I have had the privilege to travel around, across the nation, really doing this really exciting work. But personally, I've never lost sight of where my passion first started, and that was here in Rhode Island. And the first organization that actually helped me get my voice to the state level was the American Lung Association and Tobacco Free Rhode Island. So you can imagine the pride I take in coming full circle, if you will, and now working for the Lung Association. And I'm especially excited to be here with my friend, colleague, and mentor, Jennifer Wall. So I'll hand it over to you, Jen.
Thank you so much, Dan. It's my absolute privilege and honor to know you, work alongside you, and be here with you today. Hi, Rachel, Shannon, and all those tuning in. Thanks so much for this opportunity. For the past 5.5 years, I've had the pleasure of working for the American Lung Association in a variety of roles. Currently, I am the director of Tobacco Free Rhode Island, and we're a statewide network that's made up of more than 100 organizations and individuals working together to reduce tobacco and nicotine use in our state. Prior to working at the Lung Association, I worked for the East Providence Prevention Coalition for almost 2 decades. During this time, I had the opportunity to work with many organizations and individuals on the successful passage of the Rhode Island Smoke-Free Workplaces Law and other various tobacco-free local, state, and federal policies. I'm passionate about tobacco policy and have advocated since I was in high school. Tobacco advocacy, prevention, and treatment are important to me because both of my parents smoked, and I refused to fall victim to an industry that hooked them at such a young age.
Fantastic. Thank you, Dan. Thank you, Jennifer. I've been working with both of you a very long time and know you've done some phenomenal work in the field. Can you tell me a little bit about how you mobilize the tobacco control movement in previous years? What has it looked like historically, and what does it look like now in the climate of COVID-19?
Yeah, no, that's a really great question. And needless to say, being a lung disease, the American Lung Association has taken this global pandemic very seriously. And for more than a year now, our work occurs 100% from the safety of our homes. And while we do continue to mobilize and engage the Rhode Island tobacco control movement virtually, we did have some really incredible successes in previous years with our in-person work. So I just figured I would highlight really quickly a few of the really exciting collaborative projects that we've worked on. One example, you see some pictures here, is our collaborative work with local, state, and national partners for our annual advocacy days that we host at our state house here in Providence. And basically at our advocacy days, we work to prepare our advocates of all ages to educate their lawmakers about the toll that tobacco has here on Rhode Islanders, but most importantly, for them to be able to have conversations about the proven policy solutions that they're able to take that would actually change those outcomes. And probably one of the most exciting and robust campaigns that we've led in recent years was around Tobacco 21, or increasing the legal sales age of tobacco products from 18 to 21. And what we did here in Rhode Island is we collected photos and personal stories from residents in every single city and town throughout our entire state. We printed them on these large corrugated poster boards. You see that in that picture on the bottom left there. And we then lined our state house with all of those reasons, so that as our lawmakers were coming into our state house, they were surrounded by all of these reasons from their constituents. And I thought it was really incredible to see our advocates, many of which were young people, standing proudly behind their posters, surrounded by dozens of others, working towards our collective belief that we can create the next tobacco-free generation. And in fact, here in Rhode Island, I think one of our biggest successes has been our movement has been mostly youth-led. So Jen, I don't know if you want to talk a little bit more about that.
Absolutely would. I'm excited to highlight one of these youth-led projects that was supported by the Rhode Island Tobacco Control Program at the Department of Health. And this was a zombie walk, which for over 6 years empowered Rhode Island youth and young adults to stand up, speak out, and take down big tobacco. These youth-led rallies attracted hundreds to our state's capital. Makeup artists zombified everyone, and youth leaders explained how former smokers came back from the dead as zombies to warn the living about the dangers of tobacco and nicotine use, and to get them to quit while they still can. This event allowed all participants the ability to affirm their commitment to reducing tobacco use and secondhand smoke while raising awareness about the dangers of e-cigs and other nicotine-based products. Zombies marched, signs in hand, through the streets of downtown Providence. You can actually see some of that in this picture collage that we have here. And as they marched, they stopped at various locations to offer tobacco users quit resources, thank colleges and universities and local businesses for being tobacco free, and educating lawmakers at the State House. Rain or shine, and sometimes even trucking through the snow, nothing could stop these zombies from taking over Providence and taking down an industry which places a target on their backs. Moving from the past, though, into today, in the present, Dan, would you mind sharing a little bit about what we have in store for this year, given that in-person events like the zombie walk aren't possible due to the pandemic?
Sure thing. Yeah. So we actually have a really cool opportunity for any of our Rhode Islanders listening today. So we want to quickly promote our virtual advocacy opportunity. It's starting next week, actually. So on Monday, April 5th, we'll be kicking off our Tobacco Free Generation Virtual Week of Action. And basically, this is a collaborative project between the Rhode Island offices of the American Lung Association, the Heart Association, Cancer Society, Cancer Action Network, Campaign for Tobacco Free Kids, and it's supported, of course, by Tobacco Free Rhode Island. And ultimately, there'll be advocates of all ages all across our state. We'll have a virtual kickoff event on Monday afternoon, and then we will have daily points of action on a variety of different tobacco topics, including a call to local legislators about the need for enabling a legislation. We will provide some education to our new governor here in Rhode Island about the need for robust funding and tax parity, and even a really cool video project about the importance of prohibiting the sale of flavored tobacco products. So if you're interested, all of our Rhode Islanders, I would urge you to go visit tobaccofree-ri.org/ways to take action. That way you can sign up. And, I think it's important for us to just say that, yes, our advocacy looks a little different this year, but the important work still continues. We'll still have a really exciting impact. And we couldn't be more excited to be still joining all of our advocates.
This is fantastic. Thank you. One of the amazing things I think about the zombie walk is that it takes a very serious topic, but makes it fun and engaging. And sometimes that's really hard to do, to engage young people in a matter that's very serious. So we're very excited and opportunities for engagement. I just quickly want to add here, if anybody who is watching us today has any questions, please feel free to ask questions in the chat function. As we start to have conversations, and we have tobacco control specialists standing by.
Thank you, Shannon, and thank you both, Dan and Jennifer, for sharing all that information. Can you please tell us what do you think are the most critical tobacco-related issues facing youth in Rhode Island today?
Yeah, that's a great question, Rachel. I think, there's a lot of different ways to take that question. I think to start off, I think one really incredible tool that the Lung Association has for all states is one of our signature reports, and it's called the State of Tobacco Control. And we actually, just in January, we launched our 2021 report. So very new data here. And the Rhode Island report found that while Rhode Island has had some really incredible, significant steps to reduce tobacco use, our elected officials still need to do a lot more to make sure that we're truly protecting our youth and young adults from all tobacco products. Because we know, and as you'll see in the report, a third of our teens are vaping. Our children are becoming the next generation addicted to nicotine. And, we know our data is showing us that the youth vaping epidemic has really been largely driven by flavored tobacco products. And our report actually recently added a state grade calling for policies that would end the sale of all flavored tobacco products, specifically menthol, which I'm sure we'll talk about in a few minutes. And, I would urge you to go to our website, lung.org/SOTC. But really, if you're looking at the Rhode Island report, we did receive a mixed report card on topics such as tobacco control funding, quit resources, and smoke-free air policies. But if you're interested in our report or interested in your state to understand how your state fared, you can go to our website and dig through there. But of course, there's a lot of other tobacco topics that are impacting youth and young adults that you won't find in that report. So any thoughts there, Jen?
Yeah, absolutely, Dan. As you alluded to, the tobacco industry has a long history of targeting kids with flavored products, and the evidence is clear. Flavors play a key role in youth initiation and continued tobacco use. Flavors improve the taste and mask the harshness of tobacco products, making it easier for kids to try and ultimately become addicted. More than 80% of youth who have used tobacco reported beginning with a flavored product. Since October of last year, all flavored nicotine vaping products can no longer be sold in Rhode Island, thanks to welcomed regulatory action taken by our former governor, Gina Raimondo. However, plenty of other cheap flavored tobacco products like cigarillos, little cigars, dip, chew, and hookah remain accessible to our youth. And beware of a new line of emerging products available at a store near you. So check out your local convenience stores. Oral nicotine products are discreet, salt-based nicotine, which contains a formula that allows for much higher levels and efficient delivery. These new products, they come in pouches, containers like this. They come in lozenges that are kind of fluffy, gum, and even toothpicks. Yes, toothpicks. They come in fun yet mature flavors like Lush and coffee. Common brand names are Zyn, Velo, Rogue, and Lucy. These new products aren't as tightly regulated by the FDA as smokeless or combustible tobacco is, and the nicotine levels vary significantly. They go anywhere from 2 milligrams, I've seen them up to 12. Youth use of nicotine in any form is unsafe and can disrupt the formation of circuits in the brain that control attention, learning, and susceptibility to addiction. Tobacco and nicotine use is not just a public health issue, though. It's also a social justice issue, something Rhode Island youth care a lot about.
That's a good point.
Thank you, Jen. As you mentioned, tobacco and nicotine use is not just a public health issue. It is a social justice issue. Can you elaborate a little bit more on what you mean by that? And also tell us a little bit more about what you're doing as an organization to address tobacco use and nicotine use as a social justice issue. Because as you know, this is a big passion of mine.
Yep, absolutely, Shannon. Will do. Big Tobacco has targeted Black communities for the past 60 years with predatory marketing for menthol cigarettes and other tobacco products like flavored cigars. The cooling mint sensation and flavor of menthol numbs the throat and reduces the harshness of tobacco smoke, making menthol cigarettes more appealing and easier to use for young people who start smoking. The number one cause of preventable death among Black Americans is tobacco use. Tobacco-related health disparities in the Black community are largely the result of Big Tobacco's intentional targeting efforts to hook generations to their deadly and addictive products. Sadly, Black Americans are not the only target. Dan, could you talk a little more about additional populations who are disproportionately impacted by tobacco use?
Yeah, and unfortunately, we know that there's lots of different portions of our population that are adversely impacted, specifically the LGBTQ plus community, women, those of us living in a lower socioeconomic status, those with a diagnosed substance use or mental health disorder, and we're all disproportionately impacted by tobacco use. And in fact, Big Tobacco actually calls these different populations, and I quote, a market priority. And I think it's important to call out the fact that when we're talking about a product that kills 480,000 Americans each and every year, the last thing we want to be is a market priority. And, because of that, fast forward to kind of where we are now, and our data actually showing that, for example, the LGBTQ population, we smoke 2 times more than our straight or cisgender peers. And that's not a coincidence. One thing that you can actually find from the Master Settlement Agreement, a lot of the documents that were handed over, for years, the industry actually led a marketing campaign that they called Project Scum. I think that gives you a good idea of where they're coming from. And this marketing campaign was designed to target the LGBTQ plus community. And it did that in a lot of different ways. We're talking about representation in ads, which we didn't see in a lot of places. We're also talking about sponsoring pride festivals, but requiring them to allow and promote smoking, and so on and so forth. And we see these things right here in Rhode Island too. And I think it's important for us to take a second and look as well, where are tobacco retailers situated within our communities, and really understanding the density and how that looks from zip code to zip code. And actually, a recent study looked at 30 different major cities across the nation. It was the Aspire study. In one of those cities was Providence. And right here, they found that the majority of tobacco retailers actually surrounded schools. There was primarily around, the spaces where our, Black communities are primarily living. Those of us living with lower income levels are living. And again, not a coincidence. And in fact, in the study, it said that they found 199 tobacco retailers just in the city of Providence, which is 50 times more retailers than McDonald's restaurants, or 25 times more than Starbucks. So I think just putting that into perspective, I think is really helpful.
This is just a really frustrating place. It's like 2 steps forward, 3 steps back. I really appreciate you sharing this information. I think a lot of folks think just strictly about the health issue, and the reminder of the social justice issue is really important. Rach?
Yes, thank you so much. I just want to say thank you both so much for taking the time and speaking with Shannon and I to recognize Take Down Tobacco Day. We appreciate your time with us and everybody else tuning in. I also want to take this chance to say thank you to all the youth activists, educators, parents, health advocates, and others that continue to raise awareness of the problem of tobacco use in the community. Thank you all.
Thanks so much.
Yeah, thanks.